After a tummy tuck surgery, you generally have two wounds, one along the lower abdominal wall and another wound around your belly button. Now, the lower abdominal wound is closed using several layers of internal dissolving stitches, so usually no stitches need to be removed. However, sometimes during the first few months post-op, some of these stitches can come to the surface and sort of come out. Now, this can cause minor pinhole-sized wounds and irritations, which settles very, very quickly. Now, your belly button wound will often have a number of sutures around them that need to be removed after 1 week. At the time of surgery, dressings are applied involving surgical tape across the wounds and large waterproof dressings. These dressings remain intact until your first 1 week post-op appointment in our office, but you can shower with these on. Now, at your 1 week post-op clinic appointment, all your dressings are removed and any sutures are removed. Dressings are then reapplied and these remain intact for another 2 weeks until you return to our clinic 3 weeks post-op. So at your 3-week post-op clinic appointment, all your dressings are removed and then they stay off. And this is when we talk to you about wound care, or scar care I should say, and what you can do to end up with the best possible scar. Keeping in mind it takes 12 months for a scar to fully mature. And what we'd like to see at that stage is a very fine white line. However, sometimes scars can thicken and widen and end up darker than we'd like. So on the rare occasion, we may even consider having to do some minor scar revision surgery beyond that 12-month mark. Also, in some rare cases, for reasons not terribly clear, some people develop patches of discoloration or pigmentation along the lower tummy region but above the scar. So in other words, not associated with the scar. Now, whilst these often fade away, they don't always do so and can be quite frustrating. Now, an important thing to understand is that at the very beginning after surgery, and when you first get to see your wound at your 1 week post-op appointment, the scar itself or the wound itself often appears very irregular or pleated and can look a little bit, well, not as ideal as you'd like it to look. You have to ignore that because there's a few reasons for that. The main reason is the upper length of skin that's dragged down to stitch into lower length of the skin. That is typically much longer, so therefore the surgeon has to pleat that length of skin to match the shorter length. That being the main reason. The other reason is when there's a lot of residual stretch marks extending beyond that incision point, where those stretch marks are, that often causes a bit of irregularity as well. Either way, ignore how it looks in the beginning, because typically by about 6 weeks post-op, it's ironed itself out and become nice and smooth the way we want it to be. Also, we do ask that you start massaging the scar at the 3-week post-op stage. Initially, the scar typically has a very deep, lumpy feeling along its entire length. This eventually, usually completely settles, but it can take several months.